Yeah. I just see the far away shot.
Who's doing this? Well, I heard one person say,
I'll call the meeting to order. Stand if you can join me for the Pledge of Allegiance. I pledge
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, everybody. Does anyone wish to, public comment, does anyone wish to make a comment on anything not on tonight's agenda? Seeing no one, if anyone's watching on the teleprompter? Oh, please, sir, go right ahead. You're going to need to go to the microphone.
Thank you. Is everything up to date on the school committee website that's available to the public? Like all the minutes that are available, things like that?
I believe so, other than minutes that we haven't approved.
All right, the last minutes that I found were July 22nd, 2021. Is there any statutory requirement for you to have the minutes published in a more timely manner?
We just have to have them approved, and they would be as soon as we approve them. We just haven't had them on the list to approve. I don't remember doing the minutes to approve recently.
I think we approved some last.
Christina, when did we do the last approval? Okay.
Well,
So-
generally, and also on your website, you says that you follow Robert's Rules of Orders, and every committee I've ever been on, one order of business is to approve the prior meeting's minutes. So that would be a monthly thing. Why don't you have that as a routine to approve the minutes?
Because our minutes aren't ready for approval at our next meeting.
Not to be contentious, but why not?
We just haven't had them done in time. We can look on it. If you want to request those meeting minutes, you can request them and get a draft copy of them. That's fine.
Well, I don't want to belabor that one point, but you may have a draft. I mean, why would I look at a draft copy that you haven't even had a chance to look at and approve it? That doesn't sound right. I mean, matter of personnel hours, and I think maybe just a comment. Again, I'm not making a big deal of it, but I think, and I know that the most recent one available to me was 11 pages, so I know they're not short minutes.
Right.
But I think it's good procedure to have timely minutes published. And another comment, I'm going out of order here, but what I did find online, well, I found about public participation at school committee meetings. And then there was something called governance rubric for continuous improvement. Don't really know what that means, but it is kind of like a spreadsheet. And under community engagement, you may have gone beyond this. I think you're allowing public comment now, but you were being graded on public engagement. And my point is that part of public engagement will be timely publishing of the minutes. And then in the mid-cycle assessment, specific to governance rubric, again, I don't really know what that means, but it's on your website, you were graded, I don't know if it was 1 to 5 or what the scale was, but the lowest grading you got was community engagement. Again, this may be out of date, but this is what was on your website.
It's an old rubric that was used by a previous school committee.
Well, it's still on your website, and it hasn't been updated. I'm not trying to be argumentative, but I'm looking at what's available online as a citizen to get information about the school committee. And you had a 2+ and a 2+ for community engagement. We are making great strides, but still a lot of work to do around increasing access points, accessibility, visibility. Work remains on committee's goals to increase public access points, including participation in community events. Challenge without district calendar. So again, I'm just underlying the point that I think the minutes are a valuable tool for someone who wants to see what the school committee is doing. And I guess two final things. Do you operate under Robert's Rules of Order?
We do.
Okay. And what is the, there's a phrase here, how to get something on the agenda. Request to add items to an agenda shall be made to the superintendent or the school committee presiding officer in accordance with the law. So could you clarify what that procedure is and what the law is to do that?
Sure. So what happens is you can request the superintendent or I put something on the agenda. Part of it is there's certain things that can't go on the agenda. So for example, if somebody wanted to complain about an employee, that would not go on the agenda because that's not acceptable.
That kind of goes without saying. I read the guidelines for public comments, and one of the guidelines is you shouldn't be raising issues about employees or making personal comments.
Correct.
But what is the legal procedure? I mean, if you get it, what kind of communication you get, and then what are your requirements to put it on the agenda?
Usually if somebody calls us or sends us an email, that's been the procedure that the superintendent and I have used.
So an email, does that require you to add it to the next month's agenda?
No, it doesn't.
So whose discretion is it to add something to the agenda?
It's the chair's.
And is that part of the law?
That's part of the Robert's Rules, and it's also part of school committee standard practice.
Okay. There was one document that I couldn't find. It might have been that one, the school committee standard practice. It might have been that one. Let's see.
Go ahead.
I was just going to ask, are our meetings on YouTube?
Yes.
So if somebody really wanted to know, they could watch YouTube.
Yes.
Okay. That's the thought.
Sean, go ahead.
Sean Solana, coordinator of technology. I think over the last 3 years, we've really done a lot with reaching out to the community. We've added our StreamYard since COVID. We're currently streaming to all five Facebook channels for the schools, the district channel for the Facebook, also the Middleborough Public Schools YouTube channel and the MET YouTube channel. So although the minutes are not readily available, there is a recording of every meeting online for anyone to find, just as a note. Thank you.
Thank you, Sean.
Well, there was some statement in one of the documents about the governor's change of rules for allowing remote input, and there was an expiration date. It may have been extended because of COVID.
It has been.
But the proper way of doing things is to see the approved minutes. It shouldn't be up to a citizen to go back and look at YouTube. YouTube is not an official document from the school committee.
To be clear, sir, it actually is a recording of the meeting is an actual document of the meeting.
It's not a transcript. It's not an approved minute of the school committee.
Under state law, it's considered a transcript of the meeting.
Mr. Chair,
Yes.
I actually am on the community engagement subcommittee, and that is something that we've all kind of had discussions about. I'm on Facebook. I have a page that has over 1,000 members. Mr. Oakley is on Facebook with probably close to the same. Well, whatever. Doesn't matter. I just mean that people are engaging. And we found in the last few years that every avenue that we can use, we will use. And I think that by voting last year to keep StreamYard, which allowed us to upgrade this and to continue to allow people to be viewing from home, just shows that we're doing everything that we can do. I totally agree with you. I don't have any disagreements on you that the minutes should be there, but there are avenues for you to get that information. But I guess, should we discuss, should we do this every month? Should we, maybe just have that discussion? How often should we approve minutes so that people know that at the beginning of the following month that those minutes from the previous month would be on? So maybe it's worth that conversation.
I would have to go and look at the actual directive of the state about that extraordinary procedure for COVID. But the reason you have draft minutes and approved minutes is because someone's taking minutes and the committee may, and I've served on committees, may not have the same recollection. You may even, but for me to try and transcribe some, again, I like to bring it closer to like an old-fashioned system myself, because I don't think anybody should be required to look at some social media technology to keep up to date with what your board is doing. I think, I've said this to other people, and I know it may sound out of date. I really don't think public proceedings should be on Facebook or consider Facebook as providing your requirements for fulfilling your public responsibilities. I don't think that's a third-party company. There are many issues around that, but if you have policy decisions and other things, you're certainly not going with, you go into executive session, you probably have minutes from executive sessions that you approve, which will formalize contracts and other spending issues. I don't think you're telling the federal government, go look at our YouTube broadcast to find out how we're spending grant money. So I guess I didn't mean to belabor that, but, and I guess I question that if the chairperson or the superintendent does not want to deal with an issue they may feel uncomfortable with, is it really appropriate for them never to put it on the agenda? I guess I don't know. It's a comment, I guess. I don't need an answer. I thank you for allowing me to speak.
Thank you.
Mr. Chair.
Yeah.
Also, I believe that the Middleborough Public Schools are under a mask mandate, and I would just ask the gentleman to please wear a mask.
Yes.
That's not the rules here, so you need to put a mask on. No, I understand. Sean, do you have can we get a mask for him? Or ask somebody? Paul, thank you. Paul will take care of it.
But Mr. Chair, also, I think he brings up a good point, and we, like to echo Teresa, I think we could figure out some way to get more recent minutes than July up there, if that's the case. I didn't realize that.
Okay. Thank you. With that, anybody else have anything they wish to comment on, not on tonight's agenda? Seeing no one, I'm just going to jump around for 1 second and turn it over to our new coordinator of technology, Sean Siciliano, because Sean brought some guests tonight and we want to take the time to thank them. So Sean, go right ahead.
Hi, guys. Thank you, Rich. Thank you, committee. I just wanted to take a minute to recognize two members of AUKURS that's here tonight. If you look at the bottom of the agenda, there's a donation for 2 TouchView panels. TouchView is the interactive display that AUKURS has designed. It's their own product, and it's a product that they're willing to share and donate with Middleborough Public Schools. We'll be taking possession of 2 of these panels that they've donated to us. One of them will go to the MEC, and the other one will be used in another building. I just want to take a minute to thank them. We have Jay Hauser and Nicole Kelly here, and I just wanted to introduce them and kind of give them a minute to kind of explain what the product is. So thank you.
Sean, we should also mention that I know Eckers is the technology of the New England Patriots, and during Patriot games, the commercial runs, and the commercial was filmed at the MEC.
Huh.
So that's exciting too. So welcome, and we thank you very much for your donation.
Thank you, guys. Funny enough, the Patriots actually got their first 86-inch unit delivered yesterday. So thank you, Middleborough Public Schools, for accepting the Okers Company donation of the TouchView interactive touch panels. TouchView was founded by Okers in 2019. TouchView is the most utilized interactive touch panel in New England right now, with over 195 public and private schools. We're excited that the TouchView panels will be utilized at the district for teaching, collaboration, and video conferencing applications. If anybody wants more information about Okers or TouchView, please visit okers.com or touchview.com. And thank you guys again.
Thank you. Thank you very much. Any questions or comments? Go ahead, Rich.
Sure. I wondered if maybe this is a question for Sean or for you folks, if you could just explain a little bit about what's special about this particular display. I'm assuming it's touchscreen by the sound of it.
So very similar to the interactive touch panels that the district recently purchased. There are 3 major factories in China that make this product. We're lucky enough to partner with one of the top ones that makes over 14 million panels a year. And that, when I say panels, it's interactive panels, TVs, and monitors. It's locally supported in New England. The benefit that districts have chosen Oakers for their purchases is that we're able to turn around support times a lot quicker than some of the other companies that are located in California, Texas, or the Carolinas. If a warranty issue is to arise, we usually do a whole unit replacement within 3 days.
Well, I mean, myself anyways, just thank you so much. I know that these are not cheap things, and I think we're incredibly lucky that you picked us to donate these. So thank you very much.
I'm a previous resident of Middleborough. My sister is a current resident. My brother is a resident as well. So we're more than happy to help the district. I believe, as residents, we should, help when we can.
Awesome. Thank you.
Any other comments or questions? Again, we thank you very, very much. We know you tried to work with us in a variety of ways already, and we really appreciate that, and we look forward to working with you both in the future. Thank you.
Thank you.
And thank you, Sean.
Oakers Company. Appreciate it.
Next on the agenda is reports from school committee members. Does anyone have anything they wish to report? Seeing no one, I will welcome our 2 MEA presidents here tonight with us and ask them to speak.
I'll introduce them.
And this is Kate Labarovich and Sam Deschanel. So Sam, go right ahead.
We don't have a lot to report on this evening, just some things that have been happening. At the high school, we've had an open house. It was in person on September 15th. And then last night, we just finished our parent-teacher conferences virtually, and it was a pretty good turnout all around. And I just wanted to mention that many teachers have also mentioned that it's nice seeing students using all the areas of our new building, that it's a nice beginning of the new normal that we have going on. Kate?
Thank you, Sam. Sorry about that. So we're back. We're happy to be back in person and fully in person. Sam talked about the Middleborough High School events going on. I'm just going to comment on the other buildings. I know that Nichols Middle School had their very first open house on the first day of school for their 6th graders, and then for the 7th and 8th graders later in the month on the 22nd. HBB and MKG both did open houses on September 30th. And I know at HBB, I heard that the PTA had a one-night book fair sale, and they sold out every book on the shelf, which was exciting. And MEC has also had their open house. Most of the parent-teacher conferences are scheduled for the month of November, so we'll have more to talk about that. And I think that's all we have for this evening, unless you have some questions for us.
I had a question.
Go ahead, Rich.
Sure. Thank you very much. I was curious what your thoughts are on the level of engagement that you get in virtual parent-teacher conferences, because I've heard kind of anecdotally from both sides that everyone seems to really appreciate them in that format. Is that your experience as well?
Yes, at the high school last year, we had really good attendance at those, and I believe that from talking with many of the teachers, that we had full lists for classes. So we get a lot more people going virtually than in person. And if anybody wanted to not do it at that time, we can always meet with them at another time that's equitable for them.
Great.
At the elementary level, I believe the MEC is doing virtual conferences. That's the kindergarten level. And the other 3 schools, both Henry Berkland and Mary Kay Good, have scheduled in person, but with some flexibility. I sent out an email to my parents and said, I'm available these two, this afternoon, this evening, one's a Tuesday, one's a Wednesday, but I would also, be happy to Zoom with you or Google Meet or even have a phone conference. I think last year I did have a lot more attendance where people did not have to come out late at night. And so that is something we're experiencing and experimenting with. And I think that it's a good thing. I mean, we have to change with the times. And people are busy and we have this technology and it works great. We might as well use it.
Great. All right, thank you.
Thank you.
Other questions? Thank you both for coming. We appreciate it.
Thank you.
Thank you.
Natalia is not here tonight. So with that, I will turn it over to the superintendent's report.
Thank you, Mr. Chair. Good evening, and good evening, members of the committee. Good evening, folks in the audience. Appreciate you coming tonight. My first update is the COVID-19 update, to give you an update on if you hadn't tuned into the dashboard. We currently, as of last Friday, had 26 active cases in the district. That's total staff and students. We can certainly, at this point, anticipate perhaps a slight increase for this week, where we did start the test and stay protocol, and we have discovered some asymptomatic individuals who did test positive. So our numbers may have gone up just a little bit and may go up just a little bit, and that's to be anticipated under this current set of circumstances with the test and stay protocol or program in place. That will basically is a good thing in the long run, because we've identified students who potentially are fully positive and we have been removed from the school for the time being to quarantine at home. Again, all students and teachers are in the building. That's our goal. We are less than 1%, far less than 1% of our total population with teachers and students, which means that 99% of our teachers and students are in the buildings and learning on a full-time basis. So we do, and we're proud of that. We'll continue to do that. And I thank Sam and Kate for their comments about being happy to be back in the building. It does feel good to be back in the building after a month and moving on. I would tell you that in the community, according to the last Massachusetts Department of Public Health numbers, as of October 5th, we have our 12 to 15-year-old population at a 40% vaccination rate, our 16 to 19-year-olds at a 60% vaccination rate, and our town in general at a 55% vaccination rate. That's according to the Massachusetts COVID-19 vaccination data and updates, which is posted on mass.gov. So that is what's going on in the community, and that's what's going on in the public schools. Like I said, we did start our test and stay protocol. It wasn't perfect to roll out. There were some questions about it. It was a fairly detailed letter that did go out to parents that did indicate how to do it and how to go through it. And hopefully our nurses have been helpful to those folks who were confused about it and working through folks who had questions. And we'll continue to do that. And if folks have questions out there, they're welcome to call the coordinator of nursing or nurses at each building to get their information. We have partnered with the Commonwealth of Massachusetts Department of Elementary Secondary Ed and a company called CIC Health. We do have 2 individuals from CIC Health who have joined us to help test. And I believe we had a 3rd show up today, which is great news. And we are getting that. That was originally a complaint from some districts in the Commonwealth who were not getting that help right away. And I'm happy to say that we did get the help to begin this rollout this week. So that's a sort of a combination COVID-19 update and implementation of test and stay. If any folks have questions on that, now is the time to do that, if you would.
Megan, go ahead.
There's a question. I'll probably move this. There was a question online. They just wanted to know if we were testing vaccinated students as well.
Testing.
Vaccinated students?
They are exempted. Vaccinated students are exempted from the test and stay protocol.
The question previously was if they wish to be tested, could they be? And
Well, the Department of Elementary and Secondary Ed has informed us that if we accept this program, and this the program that we've adopted, we do not test individuals who have been vaccinated. That is not part of this program.
Okay.
Mr. Chair.
Good, Rich.
I don't think that's correct, Mr. Lynch. Based on where I work, people that are vaccinated, if they choose to be tested, can be tested in that program. So I think we should get clarification on that.
I have talked to the senior advisor to the Commissioner of Education, and she said if you adopted the program, that's how the program works and that's how the program operates. That was what she has told me. And I believe that's the understanding of our nurse leader and our nurses at this point, because that's what we were told. Something other than that would be something that would be aside from the policy and what the program that the Massachusetts put forth. And we were told that if you do that, then you're not working the program and you're not to receive supplies and assistance. So that's what we were told.
Mr. Chair. And to that point, I had reached out to some DESE email inbox and got a response back. That was what you're saying, Mr. Lynch, but they were a little more specific, and they said, well, actually, no, they said exactly what you said, but to say it in different words, if we were to do something like that, we could not use the CIC health people to do it, and we could not use the test kits that they give us to do it. So it would have to be a completely standalone system if that existed.
And we would, as a district, have to hire another company to produce that
Right.
program. So that is what we've been told by the Department of Elementary and Secondary Ed.
Megan, go.
Sorry, there's a bunch more questions online, so I don't know if you want me to wait and have public comment, or do you want?
No, you can go.
Okay.
Then we'll go to the public.
So people just wanted to know if they're exposed, can they choose to be tested?
They can opt out. If they have close contact, they can opt in or opt out, but vaccinated students are exempted.
Okay. And then there just was a question as to why we're not testing vaccinated people, because they can still be positive.
Because that's the program that we've bought into, that we've adopted in our district, that the Department of Elementary and Secondary Ed have put out in terms of supplies and assistance. That is the program that's been defined to us, and that's the program we're going to stick with at this point.
So my question is, can we maybe put that guidance is that up on the website?
We have it up there. Yeah, and Paula Magnesco is here, our nurse leader. She can answer
ahead.
that too.
I apologize. I just wanted to go back a little bit because some of the language can get confusing, and people asked if they were exposed, if they could test through this program. I just wanted to clarify that it's only students or staff that are exposed in school. So if someone comes in and was exposed at a family dinner, we unfortunately cannot test them. We can only test those identified as in-school exposures. And the reason, if I may, in very limited words, because it is a very complex protocol, part of the reason why we cannot test students that are fully vaccinated is because we can also not, according to the guidance that we're under, exclude those that are fully vaccinated. So while your work may have a different program, the program we're under you can't say we will test you, but we will exclude you if you don't test. It just doesn't work that way. So I apologize for the limited words, but we can't just offer to test fully vaccinated and then not exclude them. So it's actually kind of a benefit. It keeps more kids in school from my longstanding perspective of healthy people in school.
Sorry, I'm still
Thank you.
It is confusing.
No, forgive me. I asked this question specifically at the last meeting, and your presentation stated that students who were fully vaccinated did not have to be, and I asked if they could be, and the answer at the last meeting was yes, that fully vaccinated students were eligible for the test and stay, but they did not have to be. So I'm just confused because the guidance we received at your wonderful presentation last week differs from what we're hearing today.
And it's just my understanding. My understanding was that that would be reviewed by a policy subcommittee meeting. But prior to that meeting, we reached out to, you can explain who was reached out to. I did my research, and the school committee and superintendent did their research and found out what we thought we could do was declined.
So thank you for clarifying that it is different than what we thought at the end of last meeting. So I don't know if it's my turn. I'll wait to see if Meg had any other.
Sorry. People online want to know if there are any other programs that we could have chosen that would include the vaccinated people.
This is the test and stay program that was offered to us free of charge from the Department of Elementary and Secondary Ed, a very expensive program, but the CIC company they've coupled with is basically that this is the program that we've adopted.
Okay. Can COVID relief funds be used to supplement any testing kits that we may need?
Suppose we could probably designate some funds for that, but to stick with this program, we'd have to change. We'd have to leave this program and adopt another one.
Okay. I think that's it for now. So if you want, sorry, you can continue.
Okay, so I have a question that is unrelated to what I had prepared to ask. I appreciate the ability to sign up for the opt-in, opt-out online. I thought that was a wonderful addition to the email that got sent out. But if vaccinated children are exempt from the policy, how are vaccinated children being identified? Are you asking the children directly? Or is there another process when there is a close contact identified to determine their vaccination status?
I would defer to Mrs. Magnasco for that answer.
School nurses call parents, and parents will offer if their student was vaccinated.
So it's another delay in the ability to test the child, because if we filled out an online opt-in, I would assume that could expedite the process. I thought we were opting in so that you didn't have to contact us all the time. Just trying to help you out here.
We still contact parents of every in-school exposure. So we send a notification and we contact parents. So if you will, we get like a verbal and a formal written. Just something we do with a lot of things with school nursing.
All right, so my question, in full disclosure, I did email this to the school committee and Superintendent Lynch in advance of today's meeting because I didn't anticipate it being something you would know the answer to off the top of your head. And I did want to give you a chance to have the opportunity to do research instead of having to table it for another meeting. So I do want to start by saying I appreciate how difficult it is to balance providing the education and support our kids need with keeping them safe. As a parent, I also feel it is important to monitor the current situation in our district and be prepared if additional measures could be needed to keep our students safe, either for a short or an extended period of time. As we all discovered last year, many students may need additional help at home if parents are not available, and that's not easy to set up at the last minute. So in the interest of trying to be prepared if something came up, I have been monitoring the positive COVID-19 cases in schools by district that DESE posts on their website every Thursday. They have a spreadsheet with over 400 school districts and vocational schools listed. I've reviewed the spreadsheets and looked at, out of the number of reported cases, how Middleborough is faring. They do not have any data prior to the 13th of September, so those first 2 weeks of school are not recorded on the DESE website. But on 9/16, when I sorted the spreadsheet based on the number of positive reported students, and then secondarily by the number of positive reported staff, Middleborough was 5th highest out of 400 districts and schools, vocational schools. On 9/23, we were 8th highest out of 400. On 9/30, we were doing better. We were 28th out of 400. The report that was posted today has us back up. We're at 17 out of 400. This ranking does not consider the number of students in each district, so it's not a percentage. It's just how Middleborough is faring in number of cases compared to other 399 other schools, school districts and vocational schools. So at the same time, I've been looking at the 14-day average daily incidence of COVID cases that Mass Department of Health posts on their website. As of the 30th of September, looking at the 47 towns in Bristol and Plymouth counties, Middleborough was 6th highest of average daily incidence out of 47 towns. Today, we are 9th highest out of 47. So based on the numbers and wondering what we would do if the cases continued to go up, I did contact DESE through their website with the following questions, going directly to the email made available for parents with questions. My questions to DESE were, does DESE have guidance for when a school should put emergency measures in place due to the number of COVID cases? Is this guidance set by DESE or the Mass Department of Health? If there is no guidance, which agency would be contacted if any needed to be created? If there is guidance, are additional safety measures expected based on each individual school in the district or across the entire district? And if there is guidance, should a parent be monitoring case numbers as a single value, or would the measures be added based on a percentage of students or staff in a school, which means that in order to monitor for preparedness, we would need to know the total students in the school in order to be able to calculate a percentage. My initial response from DESE was a generic, thank you for your email, your stuff is important type of thing, but on asking again, I did finally hear from Matt Bayonne at DESE that there is a rapid response team for school districts to be able to contact at DESE in the situations that you are referencing. So then I said, what are the criteria for contacting the DESE rapid response team? Is this something the school district is informed of? Or is the rapid response team something the school district has to decide on their own? And Matt's response on September 30th was school districts have been given information on how to and in what types of situations to contact the rapid response team. So my questions for the school committee are, has DESE provided guidance for when to contact the DESE rapid response team? If yes, what is that guidance? If no, could you request it?
The question was the school committee.
Well, you were going to have Paul.
Okay, I can answer that from my point of view. I received your email. I did contact and read from your email directly to the senior advisor for the commissioner, who is, I believe, in charge of the rapid response team. She said this would be basically examined on a district by district basis. If we felt our district were in a position of extraordinary cases, that we could contact DESE and we could talk to the rapid response team. I didn't get the sense that there would be a team coming to the district. I'm not sure if that would be the case. I believe it would be a phone conference and a Zoom perhaps, at describing our set of circumstances. At this point, as a school district, I feel that we do have 99% of our students and faculty in the building. We've just put a test and stay protocol in place and a program in place, and we're going to try to make through this. Our numbers were going down. With test and stay, they may go up a little bit, or hopefully our numbers will trend down again to the point where we're getting down into the lower numbers. As I mentioned, we do live in a town where the number of vaccinated individuals is lower than a lot of other towns. We understand that. And we're going to try to do everything we can to mitigate and prevent at the school level. But at this point, I don't feel it's an emergency situation. I don't think the numbers are such that it requires any type of rapid response from the Department of Elementary and Secondary Ed. If it gets to that point, we know that group is there. I know that Mr. Oakley has reached out to that group, that individual, and received answers back from them. And I know that I have spoken with them, but they told me there's no trigger, there's no threshold. There is just a number, or there is a situation where if we feel it's an emergency in our district, we would reach out to them and they would evaluate the emergency on a district by district basis. That's what I was told.
So with all due respect, sir, thank you for that response. I'm not asking the question because I feel like we are in a dangerous spot right now. I was just trying to plan ahead and give other parents who wanted to put plans in place if additional measures were needed, the information they might need to be monitoring to know what to be looking for.
Okay.
So it does sound like in response to the question of have they provided guidance, the answer is no. You had to reach out to them directly to be told, if you feel that there is something to worry about, you can call us. Is that
I
a summary?
would say, I would agree with that, ma'am, in the fact that there were no specific percentages that they could provide for me in terms of numbers, exact numbers of what would constitute an emergency in a district. Like I said, what was explained to me that it would be a district by district situation, that we would contact them and they would evaluate our situation if we felt it, and they would let us know. And I'm not sure what their threshold is and what their number is.
Okay.
And that's, I can only tell you what the senior advisor to the Commissioner of
Yep, I
Education.
appreciate that. I can go back to DESE and let them know what the response was when I contacted our school district, and that his answer was not true. So therefore, I will see if I can get additional clarification.
Rich?
Mr. Chair, I just wondered if it sounds like they're saying we can reach out when we need to, but they're not saying when. And so it almost sounds like it's something maybe we just have to come up with. And I would never claim to be qualified to decide what a particular virus would warrant that type of response based on the number of cases. So I would love to hear from Mrs. Magnasco if you had an idea of what % of our district infected would equal some sort of a runaway train. I'm sorry to put you on the spot with that.
Yeah, no, I don't have anything prepared, so I'm going to have that you ask that question again. I am thinking just in terms of what the nurse's office looks like this school year. We didn't have full buildings last year. We have full buildings this year. We're managing every social, emotional, and health issue that comes into the school. So as teams, when you report data that's reported by different districts, we're not all together reporting, and we all don't have nurse administrators. As a nurse administrator right now, I'm managing direct care every day. So I'm trying to do my job and another job, but I know that the data I input is accurate. And I know that I talk to Jackie Johnson daily, and we keep track of the cases and the school age cases. I can honestly tell you in my meetings with other nurse leaders, I don't know that every other district's reporting. So when you compare data and you kind of made assessments, and I didn't follow the whole email that you read, but I just heard a lot of data in the beginning, and I ask you to kindly take a grain of salt with that, because you don't know that every nurse in every district can make that 5 p.m. deadline by 5 on a Wednesday. I'm just saying that because sometimes it's take care of the kid before we meet that deadline. And I don't know what other districts are doing. So I'm just telling you, if we appear higher than other districts, I don't want it to work against us because we're trying to do everything right.
No, I don't think this looks poorly on you at all. This isn't about we're working harder than others, or I know you guys are doing everything you can to keep our kids safe. That's what I tried to state at the beginning of everything. But as a parent trying to monitor, the best that I can do is look at the numbers that are available. And I know that this is only reported cases. I know it is not 100% accurate. It is based on an honor system. It is based on who tells you in order for you to tell the state. It is not 100%, but it is what has been reported as of right now.
Right. So when the response from DESE or whoever it is that we ask for a response from, when they say they will consider a district, I think that's a good response, because they're going to look at what's going on in that district and not just the data that actually was reported. Because if you talk to educators in other districts, they're in classrooms and they go, we knew a student was reported positive for 2 weeks from the family, but it never hit any data because everyone's overwhelmed. So I think a rapid response team that looks at a community where it's at on that day, % of hospitalization, % of positive patients, % of mild patients, % of no symptoms. These are all things that I think a rapid response team should look at. And I don't know that we can set a ceiling because the people entering the data are doing different things. So the data, you can't just have it meet a threshold, I guess is what I'm trying to say. So I hope I'm answering your question and addressing some of your statements at the same time, respectfully.
Yeah, I just want to go, you've been standing behind there for a while, so please come forward. You can ask your question.
Actually, I think that my comments are much in line with theirs. And my thoughts are that what Ms. Magnasco was saying is that when you just look at numbers, which is kind of what I was asking last week, just positive cases, it doesn't give you a good picture of what's actually going on. So I asked, are positive cases, how many of them are sick kids? And I couldn't get an answer because we're not tracking that. We're not looking at whether the child is sick, whether they're mildly sick with a sniffle like any other fall. When all the kids come back, all the sniffles start circulating. Are they not sick at all? They're just getting a positive case. Are they moderately sick? Some of my kids when they were young, they had illnesses that they were home and they were laid out. And that's part of childhood. Are we looking at this as normal, positive, parts of childhood? not just cases. And so when we're looking at is there a crisis of sick kids, or is there a number of positive cases? Is there a crisis of sick kids coming through? So there's not a crisis of sick kids. So that's kind of troubling for me when we only focus on positive cases and we're not even looking at percentages, because DESE's only reporting numbers, which doesn't help because you could have a very small community versus a very large community. Percentage is more important. But that was kind of what I'm here to talk about, because to me, I'm not for this test and stay program, but to me, my understanding of the test and stay is to identify asymptomatic positive cases. Is that the correct understanding of it?
Does anyone want to answer?
No, go right ahead. Go ahead, Paul.
My understanding of test and stay is more of trying to fix what happened last year when so many kids had to go home. As soon as they were identified as being in a certain spot in school, they had to go home for 10 days. So test and stay, to me, the stay is the part of it. Like we can test them and prove that they're well and they can stay.
You can also prove that they're well because they're not sick.
Right.
So you can prove that they're well because they don't have symptoms. And we don't need a test to show that. Her nursing skill for however many years as a nurse was capable of looking at a child, identifying them by symptoms and saying whether they were well to stay in school or needed to go home. And tests have never been they're not diagnostic. They are there to support symptoms. So they are not diagnostic on their own. They only support symptoms. So to test and to say a test and stay program is to identify positive cases so that we can remove those children that are positive and isolate them so they don't transmit, correct? So we don't lose more kids. More kids can stay in school if we remove this one. So my next problem with this whole thing, right? So you remove the positive case.
And I apologize, just trying to clarify because it is hard to follow and it moves fast, the protocols and all the things in our heads. But test and stay as a response to a positive student in school. A lot of those kids are symptomatic and went home. So then we have to look at who sat around them and follow the protocols. So I'm never focusing on finding more sick kids because we're just trying to keep those that were identified as having to go home last year and keep those in. So my goal would be when we test them, they're all healthy and they all get to stay. So I know it's kind of semantics.
I understand. It is exactly semantics because you are only testing asymptomatic kids. So if your symptomatic person is symptomatic, they're going home because they're symptomatic. You don't need to test them because if they meet criteria of being symptomatic, they're out. Now you're testing their close contacts who are asymptomatic because if they were symptomatic, they wouldn't be being tested. They were just out. So the purpose is to find asymptomatic students or staff because of their proximity to someone else. It doesn't make any sense to only test the unvaccinated students because my understanding, and maybe you can help clarify, is that the vaccine does not prevent people from getting an infection. It reduces severity of the disease, and a vaccinated person has the ability to get sick and transmit. And that has been clear. That's from the CDC. That's not me misconstruing anything. So it doesn't make sense to not test the vaccinated students to identify your asymptomatic person, to remove them so that more students can stay in school. So what DESE is doing is cherry picking their data. Because when you opt into this program, you are only now opting to test your unvaccinated students. So your positive cases are only in your unvaccinated, thereby leaving an entire data set out. So that next year, when you look at this, you're going to say the schools who opted in for this 80% you can take your mask off program, those ones are going to have a smallish percentage of students, less than 20%, who are eligible for the test and stay program, which means that the number of positive tests theoretically are going to be fewer. Positive cases will be fewer because you're testing fewer students. So this is going to lead to more erroneous conclusions based on faulty data that the schools that participated have high vaccination rates, had lower positive cases, and that is why we need to vaccinate all the students. This is cherry picking of data by DESE, and they're setting us up for this. And that is why these questions need to be asked of DESE, and not just, we opted into this program, and DESE said, we can only test these people, so that's what we have to do. It doesn't make sense, because it doesn't make sense to not collect all the data or identify all the potential people who could be spreading it asymptomatically.
Mr. Chair, yeah, I totally agree. Thank you.
As a nurse, I would like to see the mask mandate uncoupled from vaccine rates completely and tied to incident rates and illness rates and community health. And this isn't something I'm saying based on tonight. I've had this conversation with anyone. It's just from my nursing perspective that I don't know why the two were ever tied together to begin with. So as a natural critical thinker, I question that always because we have so many questions about all of this. One thing should be based on its support and the other should be separate, but I don't know why the two are tied together at all. I hope that makes sense.
I think I do, because the Lieutenant Governor and Governor Baker clearly said that they intended to do this vaccine rate policy to increase vaccination rates. They said it in black and white. They said it. So I didn't make it up.
Right.
The governor said it. The lieutenant governor said, we are incentivizing getting this vaccine so that you can take your mask off. This is coercive, this is punitive, and it's discriminatory. So when we agree to participate in this test and stay, we are agreeing to allow them to set up a study that cherry picks data. They are purposefully skewing data to lead to an erroneous conclusion, and then they will stand on that conclusion that the vaccinated schools did much better, high vaccination rate equals less positive cases, because they are not even allowing you to test children who are vaccinated, who could be at risk of getting it and at risk of spreading it. If this was about health, if this was about reducing spread of disease, then they would be asking you to test everybody. And it wouldn't be tied to a mask mandate, and this 80% is an arbitrary number that has no backing in science. And this is, I can't go into that because that's later in the committee. I won't ask now. So, I mean, that's what I think. And I think that they are purposefully setting us up for failure. And this community will be one of those ones if we don't, as you're stating, we look like we're not going to achieve 80%, which by me is fine, because I do not want to see discrimination happen here. And if you do buy into that 80%, you will be discriminating against a subset of children who choose not to, based on their health status, for whatever reason they choose to do such a thing, which is their choice. So I'm glad that we're not at that rate. But I think that there are more questions that need to be asked of DESE, and we need to hold them accountable for arbitrary measures that are punitive, coercive, and clearly forcing people to make a decision because it's easier to have their kid in school, because it's more convenient, because it puts a burden on the parent, because it puts a burden on the child to try to catch up. It's not okay, and we need to ask questions, because what's happening is not okay, and it's not about health.
Thank you.
One last.
Go ahead, Rich.
So in line with a couple of comments that were made already about the data, I don't think, I understand the point, and it almost sounds like we're doing a good job. And I wanted to take the opportunity to say I'm so thankful for Mrs. Magnasco being here in the district and doing everything that you're doing, and just incredibly thankful. I think we're very lucky community to have you here. The data is all we have at this time, I think. And so given what we heard from an audience member here, that Middleborough is ranking pretty close to last, I think this would be the trigger in my mind as a school committee member to reach out to the rapid response team and get some sort of whatever it is that they offer. So I would make a motion that we contact the district rapid response team and, yeah,
Last in what?
in number of cases. I think that was what the audience member reported, and I've looked into it a little bit myself as well. And
I'm
we're
in the
not-
health offices, I'm talking to the families. I'm not seeing a very sick community. I'm so sorry.
So what is so given the infectiousness of this particular virus, what is the number that would trigger something? I guess that's all I want to know. What is the number? Because if we don't know the number and we need a number to contact someone, where do we make these ends meet?
I don't think there is a number according to them. I don't think there is. You spoke with the same person I spoke with, or contacted the same person I spoke with. You received the same answer I did.
Yeah.
They don't have a number that is going to be the percentage point or the number, the exact piece that's going to bring on something. I mean, I believe the school committee to do what the school committee wants to do. If they want the superintendent to reach out or the school committee to reach out to the rapid response team and ask them for a formal reply, we can certainly do that. You have a couple letters tonight you're going to discuss as a school committee. Certainly include that in one of the letters.
Sure.
One of those letters had the paragraph in it that asks for that. So that's, that would be a school committee decision, certainly.
Okay.
I also know districts that have asked for the rapid response and been told no. I don't know what the parameter is, but when you ask about a healthy community, I think it includes like percentage of school-age people in the hospital, percentage of school-age people that are out sick longer than a couple of days. Like these children are recovering and they still have to stay out the whole 10 days and parents are frustrated because their child has recovered. So again, I said the data is only as good as those inputting it, and many people don't have the time to input the data. Also, the parameters are not clear, so I just don't think push the panic button unless we have a reason to. So that's all.
Mr. Chair, I think that it's been made pretty clear that Ms. Magnasco has a pretty good pulse on our district. I'd like to just say that she should be the one that would give that call to Mr. Lynch. I think that she has those conversations with every school nurse. She may not have clear, concrete data for us, but she just told us, I'm not seeing a sick community. And I think that we hired her for a reason, and the reason was to trust that she can do this job. So I would ask that we just give her that opportunity to do the job that she was hired to do. And if she had concerns, she would let the superintendent know, and I'm good with that.
That's fair.
Agree.
Kate, go ahead.
Thank you. Kate Lazarovich, fifth grade teacher. I agree with our nurse leader that we don't have a sick community, but I disagree that we shouldn't be doing everything possible that we can be doing. As a staff member in the building who just recovered from COVID, being fully vaccinated and not going anywhere really other than work, I disagree that even one case that happens is not, it's not okay. I had to go home to someone who has health risks after testing positive for COVID, after being fully vaccinated and wearing my mask everywhere I go. All my close contacts that I was around unmasked all tested negative. Where did I get COVID? I have to be in that building to do my job, and that's fine, but I don't want to be in that building unmasked, and I don't want to be in that building with sick people.
Thanks, Kate.
I thought when the two women were up here talking about the way the data is being collected and purposely not testing vaccinated students who could be systematically spreading it, I thought the gentleman with the black, I thought you said, I agree with you. What did you mean? Did you really agree with them? Because then you're talking about these other numbers that are coming from somewhere and you're ready to push a panic button. What about the point that they made? And it's not really a political point. So I got vaccinated when I could. I was quarantined. I had a person in my household who was very susceptible. We quarantined for a year. For me, the vaccine was my choice, and it's been a lot of freedom. But this lady who spoke just before me is a perfect example. She was vaccinated. She got COVID. She could have spread it. Why aren't they tested the vaccinated people? I do think there's an intent behind that.
Chair, I
Go
think, just since you mentioned me, I figured I'll respond. I can't speak to the intent of the state, and I don't think it's our board's purview to know what they're thinking. All we can do is what we ask, and I think you'll be happy with an agenda item that's coming up. So, I mean, I'll save that discussion for then. But all I'm saying is, I think you're trying to say I contradicted myself, but I don't think I did at all. I think testing everyone makes an awful lot of sense, because even though transmission is reduced in vaccinated individuals, it is not zero. And so it does seem to make a lot of sense to test both vaccinated and unvaccinated alike, and I don't understand why we don't.
I just want to make a point of clarification. I am not asking for a panic button to be pushed. I am not saying we need to pull in the rapid response team. I am by no means saying that I do not think our school nurses are doing everything possible and that they have been given an enormous burden with this additional responsibility of the Test and Stay program. But I am thankful that they are doing what they can to keep our kids in school. All I'm saying is I want to be prepared, and I'm trying to monitor the information that is available to me, made public by the state of Massachusetts, so that I can be prepared if we reach a point where we might need to call someone in. So I'm just trying to know what are the markers I'm looking for. That's all. And if the answer is it is not in the numbers, it is in the health of our community, then I understand that. But having some sense of what those numbers, criteria, sense is helpful for those of us who like to try to plan ahead.
So I get that too, and thank you. But I go back to what Teresa said too. We hire people to do a job. They should be doing the job. I'm also hesitant to do anything with DESE right now because they've messed up everything that they've touched all along throughout this process and done everything they possibly could to screw it up. So in my mind, to go back to the woman up there said, there are questions that DESE needs to answer, and I agree. And we started that discussion today. And we'll start that discussion today. I also think from conversations that I've had, one of the things that annoy me, I know, for example, you in the past brought up the Sandwich letter and the Halifax letter. They haven't responded to those letters yet. They haven't given an answer on anything. I personally don't think they intend to, at least not now. So while we're having the discussion about some of the stuff today, I don't necessarily think we have to finish it today. If people want to, I know Teresa had sent me a note that she had some questions to add, and we can add to those questions. And there, obviously, if people have questions they'd like to hear answers for, we can figure out if we want to include that. But I just have a fundamental problem with reaching out to DESE to say that we're in trouble when I'm not hearing from the people around us that we're in trouble. That's all. Go ahead,
Mr. Chair.
please.
Yeah. Mr. Chair.
Oh, I was going to let you go. You go ahead first.
Sorry.
I have been advocating for doing what Sandwich did and Abington did, and I agree. I doubt that DESE will come back with actual answers. The point of the letter, though, is to show a collective, when people start collectively pushing back against what they are doing, we need to do that. First of all, we need to do it because we are here to advocate for our students for the best education they can have, and we are being, I mean, this is not, what's happening is not the best education. They are suffering, and they continue to suffer wearing these masks, being coerced to take medical procedures. Those aren't peer pressure. All of this stuff that we teach them is wrong. We are doing, and it's not okay. So I think the point of it is not necessarily that they will give us answers, but that we expect better, that they should be making policy based on data, based on science, based on something else. But the clear thing to me, even though I know you can't, say you have an idea of what they're doing, to me it's very clear. If they are cherry picking and purposefully setting us up this way, it's to collect data in a very certain way so that they draw a very specific conclusion. They're drawing a conclusion they want to make policy moving forward. And that will be to either mask every child who's not vaccinated or force vaccines on people. So when you can see the error in it, that's time when we do speak up. You don't just it's not in me to sit back and say, I think that the guy here at the mass meeting said, what are we just going to take it off the chin? You just go, oh, that is what it is. So we just go along with it. That's what we have to do. This is the third school year our children have been disrupted. So it is time that adults in the community start stepping up and saying these children are not shields for adults. We've seen low transmission in schools. The kids that are testing positive are not very sick. And kids, this is not news, having sick kids in school. This has been always and forever. Colds, sniffles, flus, we deal with it and we move on. The kid stays home till they're well and they come back. We didn't send the whole classroom home. We didn't figure out who they sat next to and who they played with at lunch. I mean, it doesn't make any sense, and we need to start asking hard questions. I don't think we're going to get answers, but the more schools that step forward, that advocate for their children, or at least show that they care, I think is important. And that one letter from Sandwich set off a ripple effect. So then Abington did. What if Middleborough does? What's the next town that does it too? What if most of Massachusetts starts saying, give better answers? Because we want better answers. We want more for our children. So I think the letter is important. We shouldn't just sit back.
Please, my point was not to say it wasn't important, and I agree it's important. It was more to say, I don't believe there's a rush on it. If people have more ideas and want to think about it, that's all I'm saying.
Yes,
That's my only
I don't
point.
think it needs to be solved tonight. I don't think there's a deadline. And I think too, to this woman's point, the data that they're sharing, how they're sharing it, and then ranking it also is problematic. Oh, sorry. So I think how they're sharing it is problematic, because if you're only looking at cases and you're not looking at percentage, and then you're ranking it, we're not a sick community, as Mrs. Magmasco said. I mean, 26 sick kids out of how many kids that go here? I don't know how far that is off for September or October colds. I don't know. I don't think it's anything to write home about,
So-
but I just think that it's really important to advocate.
No problem. I'm going to move away from the letter conversation right now and go back to test and stay. So Teresa, I know you had your hand up, so I want to make
Yes,
sure.
thank you, Mr. Chair. I don't even know how this looks. I don't know if this is something that we can request Mr. Lynch to do, or if I can offer to look into it, but can we look into a program that is not test and stay, that allows us to pull out of test and stay as a district and to implement our own program using COVID relief funds that requires testing of anyone who is exposed or has symptoms?
So the answer is no, as we said. We can't force people who are not required to test.
But that's part of the test and stay program. I'm asking, can we not do test and stay and do our own testing program, which tests anybody?
We can't require anyone to test who the state has said doesn't need to test. That I'm using the term require. We can create our own program that allows people to test if they want to, but we can't require it.
Okay, so that's at least better. So
What?
can we look into that?
Go ahead, Paul.
The CIC offers the 3 test options: the diagnostic symptomatic testing, the pooled testing, and the test and stay. We monitored this last year from other districts that have used it. Pooled testing tests everyone or offers to test everyone, and it's been a nightmare in every district that's done it. Barely anyone is doing it. So there is an arm of the CIC program that's offered, fully supported, fully funded by state and federal fundings, that would also include the 3 nursing staffs that we're fortunate that Middleborough has through the CIC, but it did not work well. It was not well received by parents or educators. So if that's helpful, without a chair.
Rich.
Mr. Chair. I understand, I guess 2 things I understand. Number 1, test and stay can't be modified. If we're going to be in it, we can't change it.
Yeah.
But is there any, and I also understand the very real, and a former member of the budget subcommittee, financial constraints of a public school system. So those 2 things out of the way. If we wanted to be perfect on this. Could we keep test and stay as is and have a, I don't know, piggyback system where we pay for the person in the test kits to administer tests to vaccinated individuals, which are not, part of the test and stay program if they're close contacts? And I know we'd have to know how much that would cost and all that, but,
We cannot require them to take the test.
and that's fine.
Okay,
That's
I
fine.
just want to make that clear.
Yep.
I don't know if we have the money. I'd have to look at that for the budget. But what we can do is have a conversation for the next meeting if that's we're able to do that.
Sure.
Okay, and also to be able to, I would assume, we'd have to find a testing program that would be able to do that with us, if that makes sense. So
Sure.
there's a lot that goes into that. Is A, do you have the money to do it? And B, is it readily available?
Mhm.
Okay, so we can look at that and I can bring that up for the next meeting about that particular piece. Okay,
Mr. Chair.
yes.
So just a comment, and then I'm going to try and kind of group the questions together because it's a lot of
Sure.
stuff. So I did, and I apologize, I don't know your name. But when you had talked about us not reaching out to DESE and us not asking them hard questions, we have been. So I don't want you to think that we're not taking your concerns and we're not, yeah, sorry. I don't want you to think that we're not hearing your concerns, that we're just kind of sitting out, we're not doing anything, because that's not the case. So we may not have collectively sent something as a body, but individually, I know multiple people have. And the other thing I want you to know is that 3 of us are teachers. So, and we're parents. So we get it. We get what the kids are going through every day. We're going through it too every day. So I don't want you to think that we're not trying to keep everybody's interests at heart. Okay, so I just kind of wanted to clarify that from my own personal piece, I guess.
I know that you all are doing different things, but I think a collective action is important.
Right.
Measure to take next.
Right. And I completely agree with you, just to be clear. So there are a couple questions, basically kind of asking the same thing. Can we opt out of the test and stay now that we're in it to fund something at the district level, so we're testing everybody?
Yeah, again, we'll discuss that at the next meeting, so.
And then there was a question about if a kid is vaccinated but has symptoms, they get sent to the nurse. Do they get tested or do they just go home?
Paul?
Yeah.
I'm sorry, could you repeat that,
Yep.
just so I understand?
Let me just go back to it, sorry. So if a vaccinated child has symptoms, do they get sent to the nurse or no, because they won't be tested anyway?
We're still in a no illness in school policy, so yes, children that are sick in class come to the nurse. The first question out of the nurse's mouth is not, are you vaccinated? It's, let's find out how we can get you well. So I don't even know that every nurse would even ask, but if a child fit the parameter of being sick and needing to go home, they'd be dismissed and would call parent and see, because often it could be something other than COVID.
Okay, thank you. I think it was just more for clarification. And
Did I
then,
answer it? Did I, because,
I think so.
okay.
Kelly, if you're watching, you can let me know.
Oh, yeah, no, we are not doing, and that's very clear. Like I said, there are 3 programs. So there is a diagnostic test and stay, a symptomatic test and stay. Middleborough Public Schools has not opted into that. So we are not testing anyone that's symptomatic if they just come down symptomatic. We're only doing the test and stay portion. We don't test for strep, we don't test for earache, so please, we're nurses, we're not we're not physicians. We don't carry an x-ray machine, if a bone's broken, I know it by the look on the child's face, and I refer them. Does that help?
I think so. Thank you. And then, Chrissy, you probably want to ask your questions. Sorry, I was getting to them.
It's okay. It's okay. I asked him a couple times, so I was like, you know what? I can just come in. So my first question, and I think it's important because I was listening and hearing what Ms. Maganasco was saying about other towns reporting or not reporting. And so I think it's important to compare Middleborough to itself, because we can reliably say that we've been reporting and that we've been keeping track of our numbers. And if we compare Middleborough in 2020/2021 to Middleborough so far this school year, we have an exponentially greater amount of spread. We had 239 cases last year in a 170-day school year. And this year we are at Last week it said 82. We just talked about the 26. So that would be 103 cases in 25 days. And that is a huge jump. And so if that's something that we're comparing ourselves in the past to comparing ourselves to the time now, are there any additional mitigation factors that would prevent us from continuing down this path of a lot more positive cases? I don't know if you had an answer. Oh, sorry.
And again, I'm not a statistician and I didn't come this evening prepared to speak. I hoped I wouldn't speak at all. I hoped I'd just smile and wave and would all be doing wonderfully and happy. But if we look at the data comparing Middleborough to itself, last year we were in the cohorts. We were attending school 2 and 3 days a week. We weren't around school nurses. Students were sometimes home for 5 days in a row. So again, we can't really compare last year's data to this year's data for school reporting because we didn't see a lot of the kids that were sick last year. So, I mean, I get it. I get what you're doing, but please consider this year is very different from last year.
So I agree that this year is very different from last year, but we can kind of see based on that those mitigating factors of having 6 feet apart, having lunch in the gym, if that so be it, having, you know, a hybrid schedule, those mitigating factors did make a difference. At least, unless we're all agreeing that Delta variant is exponentially, again, more virulent than the previous ones. So my question goes back to, if those mitigating factors kept our numbers down and those mitigating factors are no longer in place, at what point do we consider putting them in place because our rate has risen so much higher?
Paula, go ahead.
I'm so sorry if I was saying that our rates are higher because of the mitigating factors being gone. I don't believe that. I think it's because we're seeing the students.
Right, because they're here all the time.
Right.
So, but a mitigating factor would be that they weren't here all at once, all the time. That would be
Okay.
considered a mitigating factor.
I just have one of those brains that questions data, and forgive me, it's my science background, but I'm also going to look at the social emotional health of kids, and I see really happy kids in school this year.
I agree.
I think they're thrilled to be together. I think they love sitting together at lunch. So we can't measure that by how many kids are sick. So if I can be a proponent for kids' social emotional health, I just think Middleborough's done a great job last year, having kids in more than many other districts. And I think the way the schools look this year is just wonderful. And I'm so sorry, Kate, that you were sick. And I want to do everything. I want to hug you because I'm so happy you're better. But just forgive me that I may not be a numbers person. I'm a kids person, and I'm a healthy. I just want everybody healthy, and I want kids to get up excited to go to school. Last year, I had to shut my eyes at Halloween time when the kids were all in their costumes and just hear how happy they were to be together. And we have more of that this year, and I just think it's great for the kids. So that's the lens I'm coming through. I really am impressed by what I see, the teachers and the magic that's going on in the classrooms each and every day.
And I also agree that I would prefer kids to be in school every day. In fact, that is probably my biggest thing is virtual school was horrible and I don't want to do it again. But yes, it does matter about the numbers because that means 239 kids last year had to be out for 2 full weeks with an illness, and 103 kids this year have been out for 2 full weeks with an illness. So yes, it's better if overall we're all together, but that still means that we're leaving kids out. And this year we don't even have virtual backups. Last year when they were quarantined, they could go onto the virtual classroom for their grade and keep up with instruction. This year we don't have that. And, you know, I don't know if that's something that we can optionally do as well, because I know that not everybody is opting in to test and stay, and for whatever various reasons, but I think that being a close contact is a real thing. Us having 103 cases in 25 days is a real thing, and we need to consider how can we, with the least disruption, maintain our kids in school and not have everybody getting COVID. And sorry, I have sort of a related question that nobody's kind of brought up yet, and so I'm just going to throw it out there because I'm not sure if this is the exact moment to say it. I have 4 kids, 3 of them in the Middleborough School District, and Last year, my son was a close contact twice. Both times that my son was a close contact, I made the choice to keep all 3 of my kids home because to me, it serves to be logical. Like if you live in the same house, you're spreading things around, especially with something so contagious as COVID. And so I was wondering, because obviously I'm not the only person with multiple children in the district, and I know that there is no rule that says if a sibling isn't a close contact, they have to stay home as well. I'm wondering, has anybody considered that? Because if you have one sibling home and, 3 days later you find out they're positive, now that sibling has been a close contact with countless people. So I'm kind of curious if there's ever been any discussion around how that can be dealt with.
That has not come up this year in terms of what we've done. We trust that parents would quarantine their own children from their children. I know that's difficult to do at times. But I mean, that's the best answer I can give. I don't know, Paul of Magneska, if you have a better answer but it doesn't require a sibling staying home, correct, Paula?
Correct,
Or
because we were specific, if I can qualify the question again. It was when a student is in contact, a close contact exposure in school, and they're at home, do their siblings need to stay home? That's a choice you can make as a parent, but through all public health, state and local guidelines, contacts of contacts have never been required to quarantine. If the student that was the contact that went home tested positive, that would change things because then the family would be a close contact of that positive. Does that make sense?
Yes, but that's kind of why I'm wondering, because you don't test until day 5 or later. So you might not find out for 3 days or so that your other kids have already been going to school and theoretically been spreading it around until after you hit day 5 and, oh no, now we found out they're positive.
We could talk forever about this, but when we look at historically things like chickenpox, we don't quarantine contacts of contacts. So it's just public health policy has never been to quarantine contacts of contacts. But you could.
Yeah, no, and I, like I said, I know that that's true. I'm just wondering if it makes logical sense to talk about something like that, because it makes logical sense to me that if one of my kids is a close contact and I find out later that they have COVID, now we've just close contacted 2 more classrooms of kids. And I understand that we don't have to do anything more restrictive than the law mandates. I'm just asking that we consider it.
Mr. Chair. I would agree with that, because if you have one kid that's sick, now that other kid is a close contact, they're going to school, they may be asymptomatic or whatever, but now their absences aren't being excused if they have a sick sibling at home. So now if we as parents choose to keep them home, are their absences excused?
Hold on,
I think that's where the parent kicks in. That's where a family kicks in terms of what they do for their children and how they do it for their children.
So if I chose to keep my kids home, or one of them because the other one was a close contact, does the one that I choose to keep home get excused or unexcused absences?
I would say if you're quarantining your child and you report that your child is quarantining at home, that they would be excused absences.
Okay, thanks.
No, they're quarantining. Isolating only happens after a negative test. I know it's a lot of medical terms, but I think you just asked a question that was different from hers. Hers was if a student was a close contact from a classroom exposure and at home. And I think somewhere the example you gave was that student became positive. That doesn't always happen. So we have to be in real time.
Right, but even if they're not positive. So if they have to quarantine because they were close contact, now I'm going to keep the sibling home, so that they're going to quarantine as well, just to be safe. Is that going to be an excused absence?
I think reasonableness has always prevailed with the schools and the administrators, from what I've seen, but you wouldn't be required.
Right.
Mr. Earl.
Mr. Chair, it does seem to make, so if the answer is kind of that a parent being proactive with their own student that came home because of a close contact, if the parent's being proactive and keeping their other child out in an attempt to prevent further spread in the district, if the answer is that their absences would also be excused, then wouldn't it just make sense that we just treat them that way universally, like a sibling policy of some sort? Because it seems like I understand public policy has not treated it that way, but it doesn't seem to make logical sense to me why we wouldn't.
Are you asking that we quarantine everyone who's a contact of a contact?
I'm
Because
saying
we
that
would have empty schools.
I'm saying that if a child is sent home after being a close contact, and I understand test and stay means that they test positive.
They're two different things.
No.
Two different things.
Right.
So test and stay program, kid is identified as being a close
We weren't
contact.
talking about test and stay. We were talking about qualifications for a quarantine at home. We are not qualifying siblings of those that were exposed in a classroom to have to stay home. That would be a very big change in public policy, an extremely big change in public policy.
Okay.
Okay.
Chair?
One second.
I agree it's a big change, but it's also a logical change, throwing it out there. I think so, but I don't agree with you.
In my opinion, it'd be a logical change if we weren't so damn afraid of this thing.
So we're going to move on from test and stay for now. I'm going to ask you to move on with the.
Yeah, I will move on with my report. Thank you, Mr. Chair. And the chair had asked that this item be put on the agenda because of questions he received in the community. There was a report from a student that he did have a gun in school at the Middleborough High School on September 27th. This was investigated with school administration and with Middleborough Police. Child did not have a gun. There was not a gun at Middleborough High School. That was established. The child's bag was searched, and the student did have a knife. That student was subject to the disciplinary code of the handbook, but just to report out that there was never a gun present at Middleborough High School. That student had reported out in sort of a bragging fashion that he had one, and that was refuted through an investigation. The other question came from a parent that the parent felt that they were notified a little bit later in the day than they should have. These things take time. Students have due process rights. They're subject to those, and we have to go through and process a full investigation. When the investigation was completed, the announcement went out to high school parents. It did not go out to the entire district, went out to just the high school because they were the only students affected. No student was ever in danger on that day, and I just wanted to report out on that incident just to respond to that, the question that you had, Mr. Chair. The next item is the John T. Nichols Junior Middle School handbook revisions, and we welcome this evening the two assistant principals for that building, Mr. Brian Hancock in the white shirt, I believe that's Mr. Don Rothmich. So we welcome you two gentlemen. Mrs. Latenda could not be here this evening. She was called away on a family emergency, and so she regrets not being here, but obviously family first, and she's taking care of her family matters. So we're in perfectly good hands with Mr. Hancock and Mr. Rothmich, and they're going to outline changes that were made to the Nichols Middle School handbook for your approval this evening. Welcome, gentlemen.
Welcome. Thank you very much. Good evening, Mr. Chair, school committee, and Mr. Lynch. We have made some adjustments to our handbook. We are happy to walk through those with you. First up, I'd like to just discuss where my colleague, Mr. Andy Geisel, started with you in the last meeting, discussing the high school. We have a similar policy where we have stepped forward with e-hall pass. Following the high school, they had a successful rollout of that program. We have also had a successful rollout at the middle school level. And that's been very useful for our students, our staff, and for us as school administrators to be able to utilize that program to better understand the flow of students around the building and help with any areas that come up that need assistance. We have also taken steps to, as one of the things on our agenda this evening, open up our unisex bathrooms. That we have had unisex bathrooms for several years now. We've updated that in our handbook to acknowledge the fact that we are providing access to those bathrooms to our students, and we also utilize the e-hall pass program to allow students access to those bathrooms in our building.
One of the next things that we did was we went through the entire handbook and we tried to address the social emotional needs of the students by making gender neutral language embedded into it. With that, we read through the handbook and made appropriate changes to the language there. We also went in and updated the staff titles and positions. We included school counselors and the special education coordinator information, as well as other language that had to be updated with new positions and new names. We went through that as well.
We have had an update in our TIGER acronym. So it now reflects some of our values as a school community in a different way than it has in the past. We are using it this year for teamwork, inclusiveness, gratitude, empathy, and responsibility. That better reflects our move towards being more aware of our social emotional environment and our social emotional learning goals as a school community. We've created posters to display around the building in classrooms. We're utilizing our Tiger Stripe program, where we recognize students who have made positive contributions to the school environment, acknowledging those positive contributions in those areas. And our Roar Award winners that we recognize on a monthly basis also ties into that concept of being tigers at Nichols.
One of the next things that we did was we wanted to try to connect our handbook and have some fluidity between the middle school and the high school. And so it had the looks and the information was consistent. When we did that, we found that there were some missing policies that were found inside the high school that weren't reiterated in our handbook, and we included those those old policies or updated policies and put those in. And that was all in an attempt to just make sure that there's some consistency, especially going from the 8th grade to the 9th grade, that you'll now see that there is that consistency and the reiteration of those policies in both the middle school and now in the high school.
We updated some other areas that were probably overdue for update. Book covers, we hope updated that. It's been a while since we've had students assigned a book at the beginning of the year with the expectation that they'll be bringing it back and forth to school, just in line with our movement as a one-to-one district where students, or a school I should say, at Nichols, where students are bringing devices back and forth and using those devices primarily. We still utilize textbooks in the classroom environment. Students still bring trade books back and forth, but it's been a while now since students have regularly brought textbooks back and forth and been expected to cover those textbooks in school. Similarly, access to phones. We moved to a phone-based system where we have internet-based phones in all of our classrooms at Nichols. And so we no longer have to have one primary system to get kids to the office to have access in an emergency to call home. Teachers have been able to work directly with students to give them immediate access to a phone if they need to get in touch with someone at home. So just adjusting the language a little bit in some areas such as those.
With that, we closed our handbook with the current calendar. That was something that was missing that we wanted to make sure that was included in there. So we did include the 2021-2022 academic calendar that was found on the district website. We did include that in there as well. And that would conclude many of the changes that we did to try to get ourselves back on track with our handbook this year.
Any questions?
Questions from the committee?
Meg, go right ahead.
Can you repeat what the acronym stands for again?
So our TIGER acronym is now teamwork, inclusiveness, gratitude, empathy, and responsibility.
Thank you.
No problem.
Other questions? Zeke, go right ahead.
In terms of the e-hall passes?
Yes.
I was just wondering, what does that cover in terms of, does it just cover going to the bathroom, or does it cover going from one classroom to another? What are the purposes of getting, or I guess what Why would an EPAS be issued, I guess?
So we utilize it basically for any movement of students that's not directly with staff supervision, or with a staff member. So if a student needed to come to the main office, they would have a pass created for them, similar to the old days where they would get a laminated pass and they would go. But in a similar fashion, that they also allows us to schedule meetings with students. So our guidance department can schedule a meeting with a student and it will create an automatic pass for them. If they schedule ahead of time, it will send them an alert and an email just reminding them what's coming up in their agenda to meet with whichever person in the building that they're meeting with. They're able to sign out to go to the media center, and we can create extended passes for those sorts of things, round trip passes to things like the bathroom, or we're able to create passes that we can interact with. So if a student has a pass to see me in the office, I can click the pass to say that I've received the student so the teacher can see that the student has arrived, and then I can click the pass to return the student to class, and the teacher will know that that student is back on their way to their care again.
Right, and with that, does that come with like sort of a timed, like a timer, like, or they have 2 minutes to get to this location, or is it tracked in terms of, it took them 2 minutes to get to this location?
The later, yeah, it would track their timing, and when they sign out to use it, it keeps a little timer so the student knows how long they've been out of class, that sort of thing.
All right, thank you.
Mr. Chair?
Megan, go ahead.
Thank you. I'm not sure what the question is, but can you touch a little bit more upon the gender neutral pronouns and name changing? I'm not sure if any of that's in the handbook, but I think there's some questions on there. They're not really questions, but if we could maybe clarify.
Sure. So what we did was, instead in the handbook, it often represented students as being he, using only he. Sometimes it would be he, she. What we did was it reworded it so it would refer to the student to try to make it more neutral. And what we did was we read through the entire handbook to try to catch all of the single pronouns. What we found is that often in the handbook it assumed the male pronoun through in many places, and that was one of the things we wanted to make sure that wasn't there. So some of the language would just be a re-sentence structure so that it would address it as the student, and that's kind of how we tried to adjust most of that. Occasionally in some of the statutes of course have to stay the same because the statutes are just that. It's legal law, but where we had the opportunity, we tried in any place that we could find to be able to address that. And so that was how we addressed the gender neutral language.
And then just one more follow-up. So, and I'm not sure, maybe parents want to contact the school for more clarification, but they want to know if children or kids are deciding to change their name. So if my name is Megan, I want to be called Billy. Are parents being contacted about that?
The counselors have a better handle on that of the privacy of how they want to be called, but we do allow for all students, if they want a specific name, that we respect that, and we do allow that change to happen. We just recently are rolling out an alert on our Aspen, which is our database, that allows us to put notifications in to make sure that people will use certain pronouns for certain students. And that's something that Katie Godine has been working on, and she's just recently rolling that out. And administratively, we're looking at how to best roll that into our teachers so that they can have that access easily available on their Aspen, which is the database for the district.
Thank you.
You're welcome.
Anyone else have any questions? Go right ahead.
I had a question kind of based on a similar thing. So if a student chooses a different name, to be called in the school, how does that work you said you might note it in Aspen. Do they have to do their birth name for testing? Do they have to do their birth name for a school ID? Like, under what circumstances would they still have to use the name on their birth certificate?
So for testing, there is a like an MCAS protocol, which is for their SACID members that we can follow that allows for that, as well as DESE gives some guidance to give us for like, without going back and reading it verbatim, there is a system in place that we can keep parallel all of the new name choices and link everybody together. So we would be able to say a student had several name changes. There's a process that DESE gives for guidance on how to keep track of that, including the database for Aspen. And Katie would be able to have a little bit more, Katie Godine would have a better, more technical answer for that.
Do they have to be legal name changes then?
A legal name change would go into Aspen. And without the legal name change, it goes through the DESE guidelines, from my understanding.
Can you possibly tell me where to find that guideline?
I can find it and I can share it with, if you give me contact information, I know where to find that on DESE.
Awesome,
Yes.
thank you.
Yep.
Other questions? Rich?
Just a comment. Thank you very much. I know there's a lot of language in there, and I just wanted to applaud you and your team on the focus on inclusiveness that I see throughout especially the log of handbook updates. So just a thank you for all the work that you guys did.
Thank you.
Zeke, go ahead.
And then I had one more question, sorry. So you said that there were policies that were incorporated from the high school that were missing in the middle school. Can you give me a breakdown of what those policies were?
Sure. Many of the policies that were put on the memo that you had, but like, for example, one of the ones that was kind of out of the box that I put in was the one for, if you take a look, the policy on dissections and dissection alternatives. So for example, like our 8th grade science teachers would be doing body systems, and they may decide to incorporate certain dissections, like maybe doing a shark or a fish or certain other avenues. There is a process that science teachers need to take in order to do those dissections in the lab. Although you almost always see that at the high school level in those courses, anatomy and physiology, there is, because we give the autonomy to the teachers, those teachers could incorporate those types of activities and after-school programs in anticipation for future plans of potentially integrating more hands-on activities after school. That policy would be pertinent to have in the middle school level. That would be an example, other than just literally looking through all of the identified policy additions that we noted on the memo.
Thank you.
You're welcome. Thank you.
Any further questions? Seeing none, the chair would require a vote to approve the changes to the handbook.
So moved.
Do I hear a second?
Second.
Discussion. Seeing none. All those in favor say aye.
Aye.
Opposed? It's unanimous. Thank you for all your hard work. Thank you.
Thank you, gentlemen.
Thank you, guys. Appreciate it. Have a nice night.
To continue with my report, I put on here Middleborough Ice Hockey Group, and I just wanted to acknowledge this group. A lot of times we do hear about MASBA and their contributions, the Middleborough All Sports Boosters Association. This is another very important sports boosters association that we have in this community. They basically do fundraisers, a couple of major fundraisers a year, and pay for, on an average year, of between $15,000 and $20,000 worth of ice time over at the Bridgewater Arena, so our teams can practice, and it defrays anything that we pay for in the operational budget. So the ice time that the Middleborough Ice Hockey Group provides and the money that they provide through a golf tournament, which they held last weekend, and through usually a midwinter celebration, usually held at the Elks, some type of event, goes right to our ice hockey players and in the development of our athletics. So I just wanted to mention the Middleborough Ice Hockey Group to give them a little note out there of thanks to the community that they work real hard. And we saw that in motion this Saturday. There was a golf tournament. I know the chair played in it. I played in it out at Sutter's Marsh, and they had a lot of raffles and a lot of community support. And we thank them very much. I just wanted to mention the ice hockey group. So if anybody else has anything to
No, they do a fantastic job every year. They put on the golf tournament, and they also put on generally a dance in February, held at the Elks. They do a really nice.
Yeah, it's sometimes a comedy show
Yeah.
and sometimes a musical show, but it's fun. And again, the support of the community is right there with raffles, et cetera. And it is a hardworking group of volunteers, like yourselves, obviously, who are dedicated to the students of Middleborough. So we thank them very much.
Me too.
My last item here is MCAS. MCAS results are in, and the administrative team is analyzing the results, and we will have a report to you at our next meeting or the meeting after that, depending on our chance to get together as a group and analyze what we have. We don't have a lot of comparative data this year. As you know, the MCAS was shortened for this year, and we'll report out on exactly what we have for the committee in a meeting in the near future. So we have a meeting scheduled coming up to begin the analysis. Each principal has already done the analysis at their buildings, and we'll get it together and put it in a uniform presentation for the committee. So, and that's my final notice on my report this evening, Mr. Chair.
Thank you, Superintendent Lynch. We'll now go to the policy subcommittee for the first read of 2 policies. Good, Rich.
Mr. Chair. It was actually a really great process to work with. So Meg and I are the policy subcommittee. We worked with Sarah Hickey, Hutch, Ryan Sylvia, Sean Siciliano, Principal Brannigan, probably missing someone in there. But it was really a great way for me personally to learn an awful lot more about what the district offers for facility rentals. But just to give a rundown of what we did in this, and Meg, please jump in if I missed anything or if you want to add anything. For the most part, the policies themselves, and those policies were KF, which is community use of school grounds and facilities, KFR, which is community use of school facilities, and KFC-R, use of school department fields. We made very minor changes to the language of those policies, but if I could just sum up specifically what we did, we made certain things match across those 3 policies that were kind of a little jumbled. In particular, there was some language around smoking and drinking on school grounds. We just made the language match. It was the same in intent, but we just made the language match. We also did add vaping. It seemed relevant these days to that, but I think the most important part of what we did in this was hear from all of the stakeholders, from all of the facilities that these policies impact about the costs of those facilities, and are we covering our costs as a district? Is it fair? How do we line up with surrounding districts? Meg, if you're okay with it, I'd love to turn it over to Mrs. Hickey to talk a little bit more about some of those numbers changes that we made.
Thank you. Over the past few years, Cheryl DeBenedictis, who is our facility rental clerk, and I have had conversations about the facility use rates and compared what we charge for facility use in compared to what we pay for custodial staff. And with the opening of the new high school and the fantastic facilities that we have to offer here, we felt it was a good idea to take a look at what we were charging for community use and we broke it up into some different categories for community use. We broke it up into nonprofit community organizations, for-profit community organizations, nonprofit non-community organizations, for-profit non-community organizations. And we studied the facility rates at neighboring towns that had similar facilities to what we offer and used that as a guideline to establish a new rate system for Middleborough.
Sure. And Mr. Chair, if I can add, I think it was kind of nice for Meg and I to be there, although we totally trusted the stakeholders that were giving opinions on what the numbers should be. It was just kind of nice to hear the rationale and that we do value those community organizations and community nonprofits as users of school facilities. So I think that the fee schedule that we came up with was very fair in that regard, and it did mirror our stance from the previous fee schedule as well. It was just updated for modern times, really.
I did want to point out that we kind of went into this with the fact that we have this beautiful new high school and we don't want things broken. I know I have a drama club at my school and there are groups that come in there and they break the audio equipment every week and I have to fix it every week. So we don't want that to happen here. So that was kind of like at least my mindset. And then the other piece of it is we didn't want to like price gouge anyone. We didn't want people or groups that were paying nothing or paying $50 to rent, a classroom to all of a sudden go up to $200 because that's not fair to the community. So we did try to keep that in mind where we could, where it was applicable. And then we just wanted to make sure that we're protecting what we have here so that it lasts for everybody.
Mr. Chair.
Mr. Siciliano.
Just to talk about the use and things like that. When we have anyone that's using any audio equipment in this facility or any other areas, there's asterisks in there, and you'll see that requires a worker to be here. So we would hire a student like Derek at a lower rate, or if it was something more complex, it would be an adult, as in me or Mr. Pelletier, just to be here to monitor and to operate those things. So as we talk about usage and things not getting wrecked, I'm sure that the church group that comes in has the best of intention setting it up how they want it set up. And there's 1,000 ways to do things on digital audio boards. And we want to make sure that they get their product, but we also are able to save ours. And so when we come back in on Monday, we can operate it normally. So thank you.
Just a quick question, and I apologize because I don't know if it was sent to Dropbox and I just didn't get a chance to see it, so I have not read it, so this may have been answered. But are we offering a different rate for for-profit and nonprofit? Yes. Perfect, thank you.
And just to expand on that, there's kind of two classes of both. There's in-town, correct me if I'm wrong, in-town nonprofit, in-town for-profit, and then there's an out-of-town both as well.
Excellent, thank you.
So the only thing I want to add was I asked Mr. Oakley to add to, and I'll let everyone know, which is just add to the bottom that says the superintendent or his designee can change contractual rates. And that's mainly because over time, as you can imagine, for example, rates for custodian go up. We don't change it in a timely fashion, and they have to abide by what the policy is. So that's why if they can adapt that to whatever the rates are as we go forward with contracts.
Great.
I think over a period of time, we can look at different things, but it doesn't have to be a policy that comes up every year if we're just changing the rates for contractual pieces.
Mr. Chair, one more question regarding this. This is the first read. I think it would be important for the community to know we have to do 3 reads.
So we go through 3
reads
readings,
and vote
but
on the third.
just to understand. So for example, with this building has no rates attached to it as of yet. Even though we'd go through 3rd reading, the superintendent and his office would still follow this rationale because it's the only one in place.
Okay.
Does that make sense? So even though we still have to go through, we're going through 3 readings, so people can provide input.
Sure.
If somebody sees something they want to change. And we've changed over a period of time, just so everyone knows, we used to have a piece in which some programs would have to hire an outside monitor. If you remember, Brian, when we first started, and that didn't make sense to us. We changed that. There were different pieces that, the monitor is okay if something goes wrong and people aren't correcting things and they're constantly being problematic. But I don't want to start off with somebody having to pay for a monitor type of thing.
Thank you.
So tonight would be the first reading. But like I said, the high school fee structure would go in place because that's the fee structure. That's the only fee structure we have for the new high school. Any questions? With that, the chair will entertain a motion to accept the first reading.
So moved.
Do I hear a second? Discussion? Somebody raised their hand? Yeah. We'll put it on the website. Thank you. Any other questions? Any questions from the committee? Hearing none. All those in favor say aye.
Aye.
Opposed? It's unanimous. Thank you, Mr. Oakley.
Thank you, everyone that helped us to do that. Meg and I pretty much just hung out and listened and occasionally threw in a couple comments, but it was an awful lot of work for a bunch of folks, so thank you.
So next item on our agenda is the letters to DESE. There were 2 letters attached. The first one's from Mr. Oakley, so I'm going to bring that one up first. My only particular piece with that, Rich, is it seemed like we had a conversation similar to it.
Yep.
And so I would feel that we wouldn't send that at this time, based on the conversation we had, just so everyone understands. Mr. Oakley was asking our district to seek additional guidance from DESE on what level per capita should trigger action by our school district, such as additional mitigation strategies and what actions might be appropriate. Again, from the conversation we had, it seemed like we wanted to wait and have our administrators. I could be wrong, but that's what I was feeling that this board was saying. So that's why I bring it up that way.
Sure. Yeah, Mr. Chair, I guess as the writer of that letter, I'd be happy to follow what you're saying about getting some additional feedback from our administrators and coming back next meeting and talking about that.
Okay. Does anyone have any objection to that?
No, I just have a question.
Go ahead.
Can we present these somehow so people can see them?
Yeah, we can put them up. That I don't think Sean has them.
It's short. You want me to read it?
Yeah, go ahead.
Okay.
Sorry.
I just said, and this was just a draft letter for the committee's benefit to start a conversation, just to be clear. So dear Commissioner Riley and members of the Board of Elementary and Secondary Education, the Middleborough School District has gone from 466 cases per 100,000, which is just per capita. I'm just using it to compare districts. It's not a good number for just looking at a single district. Anyway, sorry, has gone from 466 cases per 100K, which equals 14 active cases in a district of approximately 3,000 after 6 days of school, to 866 cases per 100K, which is 26 active after 11 days of school. Middleborough as a town ranks 293rd out of 303 municipalities with reportable data on the mass.gov municipal vaccination report dated 9/14/2021 for percent fully vaccinated individuals per capita, with a current value of 49%. We believe that our district is in a unique position statewide, and in order to best serve our students in our community, our district requires additional guidance from DESE on what case level per capita should trigger action by our school district, such as additional mitigation strategies, and what actions might be most appropriate. Thank you for your time.
And so I'm seeing that we decided to
Yep.
table this till next meeting.
Yep.
So I'm going to move on to the next one. The next one was we had discussed certain questions for DESE. I wrote the letter to start, and I sent the note to the committee. It was open for discussion and people adding more questions. So I'll read the letter. Like I said, it was just a start, and it was basic questions. Dear Commissioner Riley, September 27th, you announced the extension of the DESE mask requirement and outlined the implementation of the DESE policy on vaccination rate threshold. After reading and reviewing both those documents, the school committee wanted to ask further questions and receive clarifying information. They include, how did DESE decide upon the 80% vaccination rate to allow unmasking at schools? What research and scientific data was used to decide upon the 80% rate? What other agencies participated in the creation of the policy on vaccination rate threshold? The motion at the August 27th meeting allowed the commission to require masks for staff and students through at least October 1st. Why did the motion not include any language around the acceptance of a policy on vaccination rate threshold? And the last one was, when districts come together for events, what guidance would need to be followed about masking? And so those are the questions I had. Meg, go right ahead.
Can we either add or change what other agencies? Could we change that to what other stakeholders? Because I think it needs to be
Sure.
more than just agencies. It needs to be parents, teachers, students.
Yeah, well, I would say this, that I don't believe stakeholders were involved, so that's why I didn't pick stakeholders. What I was more looking for agencies was was the Department of Public Health involved? How did he get to the 80% raise and who he included in that? So that's why I said agencies. I'm fine with doing a stakeholder as a separate one.
Yeah, okay,
But to me, it was, agencies were important based on that.
thank you.
No problem.
Mr. Chair.
Go ahead.
I definitely would like to add that we request or ask, why are we only testing unvaccinated and requiring unvaccinated through this test and stay program? And I do also think that we should be a little more elaborative on our questions. realize that this was just some ideas that you put together, but I think that when we do write this letter, it should really be comprehensive and elaborate on each question as to what we specifically mean by those questions. I'm certainly more than happy to sit down and start putting those thoughts together. I don't know if anybody else would like to do that, but I think that, just asking a question doesn't really just show exactly how we feel as a district. So does that make sense, what I'm saying?
I understand what you're saying, but I will say that it has been my dealing with DESE in the past that, in my opinion, and entirely up to the committee, and I understand what you're saying, if you ask specific questions, then it makes them harder to not answer those specific questions. That's what I found. And so that's why I did it in sort of just a straight out question format. And again, I did it to start the discussion, as I said, Teresa.
Yep.
But it was more about asking the specific questions that people wanted answers. So that's why I did it that way. I'm open to other ideas, obviously, like I said, but I just wanted to say why I did it that way.
Sure. Fair.
Teresa, did you have other questions?
No, that was my big question, was just regarding, the testing and how can we implement our own program to include all.
Okay.
Yeah.
Anyone else have other questions? Okay. Go right ahead. And I just want to make one clarification too, so everyone understands. I stayed away from masking. And the particular reason I stayed away from masking was because if you look at what DESE points out for masking, they cite the CDC and the American Academy as to the reason why they're doing the masking. So I'm just saying, in some
Masks are really
respects,
important, and because they tied the masks to the vaccination rate, that is a really important question that needs to be on there. And actually, so I think it's really important. It's tied to vaccination rate.
no, I don't disagree with you. I just meant masking in general, because I think that's how he gets away with the masking piece, is he puts in that particular data. This piece that came out, even when it came out last week, because it was tied to the extension, had no data attached to it. Nothing that you could look at and say, this is why we chose 80%. I've heard through the grapevine that I don't know that the data exists. They're waiting for a survey to come in, but again, they don't have anything they can point to, and I think that's part of the reason why some other letters haven't been answered.
Right.
But I don't
Well,
disagree with you
haven't
with how you tied
established-
masking to
They
this.
haven't established a herd immunity threshold for this virus, and because it doesn't appear that you can create herd immunity with a vaccine when you cannot stop transmission. So in order for you to create herd immunity, you would have to stop transmission, and that isn't happening with this vaccine. So you can't establish a herd immunity threshold, which would give you a percentage like 80% if you can't stop transmission. So a percentage isn't going to exist because you can't establish herd immunity.
Right.
You could maybe through natural immunity, because it does appear that natural immunity is durable and robust, and it's lasting far longer than the antibodies are proving to last from the vaccine. So, but that's not what I meant. I think we need to really ask about why the unvaccinated students would be allowed to remove their masks, particularly because we know that they can get it and spread it. So when you do that, and we know that that doesn't support that statement, it's really clear that this isn't about health. This is just really about being punitive and to increase vaccine rates, which are what the governor and the lieutenant governor said. So I think that is an important question we need to include in there. My other question that in the spring, they gave themselves the authority by changing a regulation that would affect in-person learning time by being able to adjust those in the event of a state of emergency or exigent circumstances. Now, I understand when there's a declared state of emergency, that's kind of clear in my head. The governor declares it, could be a natural disaster, could be a war, could be this, but exigent circumstances is what? What is exigent circumstances? How do they get to decide it? I mean, can they decide if there's too many paper cuts in the school that paper must be dangerous, and so we ban all paper because it's, you know, could lead to infection? I mean, is that an exigent circumstance? What is a circumstance that it's, I mean, it's vague. It means nothing. They just gave themselves some authority to do what they want and create public health policy. So I think that's important. Asking them, and when does it end? When does this exigent circumstance end? Because right now, everybody else in the community is doing one thing, and once you step a toe in this school, it's a whole different apparent transmission rate. So I think we need to ask about exigent circumstances, as well as in that guidance, sorry, I wish I had it right in front of me. It said that in alignment with statewide guidance, that unvaccinated staff and students will be required to wear masks. However, that is not alignment with statewide guidance. So when you even click on their hyperlink that brings you to the statewide guidance, the only place that masks are required are by federal law or federal mandate in public transportation and in healthcare settings. So it's an actual lie right in their letter, because it's not in alignment with statewide guidance. They are saying it is, and it is not. So if it was in alignment with statewide guidance, then it's an advisory. It would be, which is what the guidance says, that regardless of vaccination status, you should consider wearing a mask inside places, in public settings. But it's an advisory at this point. So we need to ask why they would lie.
No, I'm taking it in. I'm writing it down. So
Sorry, I know you're mentally processing it. So, yeah, I mean, I think those are two really good points. We need to ask why our masks are tied to vaccination rates, why they get to declare exigent circumstance so that they can decide public health policy, and why are they saying that statewide guidance is something that it's not? Because if we're in alignment with statewide guidance and we're doing what the state was doing, I think I could be okay with that.
Okay. Great.
I'm not sure of the process here, but I'm just voicing my support for a lot of what Ms. Kern said. I am opposed to the partial masking and unmasking of the population. If the state, if the health officials feel like we have to wear masks and they want to have everybody wear masks, that's what they've done. But I don't like the language that only unvaccinated children will be required to wear masks. I think that's unfair to the children. I like the point about the community. You know, the school systems are being asked to follow different guidelines than the rest of the community. I think that should be put as, I mean, I'm not sure how much opinion you want in here versus questions. I'm happy to start a separate letter.
Well,
that's more opinionated.
Yeah, I don't view it as opinionated if it's a straight up question.
Yeah.
So, and that's why, like I said, I am fine with, I think it's, in my mind, it's more helpful if you're asking a straight up question. I don't have a problem with asking why unmasked, you know, people can go unmasked, et cetera. I don't have any question about that. And I think you can phrase them in just plain out questions. And that's been my point. My point is, like I said in the past, when dealing with DESE, if you're asking them specific questions, and I would also say their answers can drive obviously more questions, right? So if they come back with questions, with answers, then we can look at the answers and say, well, why doesn't this match this, or why doesn't that match that? And that's okay to ask. So that's all. I would sort of staying away from opinion, but as long as they're in the form of a straight up question, I don't.
Yeah, I would
don't
like
see a
to
problem.
make sure that, I would like to have that question asked about why are they differentiating the masking based on vaccination status?
Nope, and that's fine.
So yeah, I totally agree with that as well. I think if we're universally masking, it shouldn't matter whether we're vaccinated or not. We're giving out personal health information by doing that. And, you know, that's shaky ground to begin with. I will say that I think if we're asking questions about numbers and percentages, I think maybe if we are writing an official letter, maybe that is the time to sort of ask some of those questions that Mr. Oakley was mentioning. What are the numbers that would spike us to be, using additional mitigation measures? What are the numbers? Where are these numbers coming from? Just as you said about the 80%, I think that if we're straight up asking questions, we need to straight up ask questions on both sides of the issue.
I think to address that, I think we are, I think that it sounds like that's the plan anyways, and that the stuff that I read that I had drafted, I think it sounds like, Mr. Chair, we would put some of that stuff in there as well.
Yeah,
if the
either that, we
committee
can do it
agrees.
as one letter or whatever. That's a discussion for later. We're going to table that particular piece. Go ahead.
Thank you.
Greg, go ahead.
Thank you. I'd also like to, would it be appropriate to ask about the test and stay program? Like why aren't vaccinated students allowed to be tested in their program?
Yeah, I mean, that came up from today because I wanted to hear from Paula and everything like that. I think that's a reasonable question.
Okay.
And it relates to the mitigation factors. Here's a mitigation factor that you're supposedly using, but yet why are they not doing this with it?
So
Does that make sense?
I would like to see that in there.
Okay.
And-
And I'll put this on the next agenda with those questions added to it so everybody can see. If people have more questions, please feel free to send them to me. Now, I think I wrote everything down, but ma'am, if you want to email me your questions, go right ahead, just so I don't mess it up. I believe I wrote down everything, and anybody wants to do that, that's fine. Okay.
So just so I'm clear on the process here, you're going to try to collect everything into a letter?
Yeah.
And we'll have this on the agenda for next meeting?
Yeah.
And then, so the next meeting will be kind of a read-through and, or making changes if we want?
Yeah.
But then it'll come to a vote at that?
Yeah, I would say so. It's a letter that the full committee is going to, and then
And then
we
we can
send out
take a
after.
vote on it? Okay.
Okay. And just for clarification point of view, Teresa, you had mentioned the language. Does it make sense to just ask the questions as sort of standalone bullet pointed questions to this committee? That's what I'm wondering.
Yeah, Mr. Chair. I think it makes sense because if we're asking these questions to get answers to possibly change our approach here, then I think it makes sense to just ask the questions and get the answers. And then, like you said, if they give us something that does not quite seem right, then we can do something about that. But I think I would tend to agree with you, and I would hate for us to shoot ourselves in the foot by injecting more than needs to be in this letter and then not get a response. Whereas if we do get a response, we can possibly act on that sooner and do what we're supposed to do up here, which is serve the community. So that'd be my opinion, I think.
I just want to be clear because, this has been in the past, my way to deal with DESE when I've done it with school committees. That's not to say it's the right way, nor it's the way that this committee wants to go. I'm perfectly fine with going with either way. It's just if I'm putting together a letter, I want to know how you guys want it put together. That's all. Thank you.
Yeah, I think if we just, and obviously this is a draft, so you probably haven't gotten to a conclusion, but in the conclusion, if you just kind of summarize why we're asking these, and I think that kind of meets what you want to do, but it accomplishes just having the bulleted questions.
Yeah, no, that's fine. And I don't have an issue with that. I intended to do that. It was just more to start the discussion that you guys work with.
And Mr. Chair, just to be clear, I think one of the things or the reasons why I brought that up was just based on what Ms. Janess had asked was, could we ask about stakeholders? I just want us to be clear that when we ask that question, they're going to understand it exactly the way we want it to be understood. So however it's worded, just as long as it's understood by them, exactly what we're asking is what I mean.
Go ahead.
For that specific question, maybe rewording it to say, was the Department of Health involved or other agencies or something like that, if we're specifically wondering about the Department of Health?
To be honest with you, I'm not specifically wondering about any particular agency. I want to know what agencies were involved in the decision because I have a funny feeling that they weren't, and it was DESE who came up with the policy themselves.
Okay.
That's all. I mean, that's why I didn't word it that way for that very reason. That's all. Any other questions or comments? Then we'll have this at the next meeting, okay? Thank you. Middleborough Building Project, we have a meeting next week. I don't have any updates from, because we haven't met.
The Phase 6 front parking lot is nearing completion. We were hoping to have it online on the 15th, but it may be a little bit longer than that, according to reports. I was not in the owner's architect's construction meeting today. I could not make it. I happened to have a very nice meeting with the new president of Massasoit Community College, which I think was more important for me to attend this morning. And I've gotten word from people that were at that meeting that the lining will not be able to be done, that the top coat, and I know Sean was in that meeting. Sean, if you don't mind, our coordinator of technology, coordinator of district technology, Mr. Sean Siciliano.
Yeah, so just an update. The goal of this entire project through phase 6 has been to get us that parking lot for homecoming weekend. They were on schedule to do that. They had thought that they would be paving the middle of next week with the final coat. We wouldn't be getting it with the stripes, with the parking spots, but we would at least have the finished grade. Because of the weather and all the rain they got, they're not going to make that deadline. So they do have raised structures. They're going to patch those so that they pitch up. The temporary asphalt will pitch up to the raised structures, and all the ADA will be maintained through with temporary patch for pathways and stuff like that. So we will have that parking lot at this time for homecoming weekend. And then once homecoming weekend's over, we will give it back to the construction company. I'm assuming for probably 2 weeks or so. But lighting will be up and cameras should also be operational by the homecoming weekend.
Thank you, Sean.
Thank you, Sean. Just a reminder that the MASS convention is November 3rd through the 6th. Chair will entertain a motion to approve the consent agenda, which is 2 fundraisers.
So moved.
There is a second. Discussion. There for the Key Club, which is paint night and Eat to Heat. Eat to Heat is an annual event in which they help defray the costs of people's heat during the winter. So they do an excellent job there. All those in favor say aye.
Aye.
Opposed? It's unanimous. We have one surplus item on our Rizzo machines. So Brian, did you want to explain that just briefly?
Just wanted to mention that our RISO machines are getting to the point where they've aged out, and some of them are at 8 or 9 million copies. We have a service contract with the company Boston Business Technologies. They're a provider on the state bid list, and they are at the point where these machines were costing us $16,000 or $17,000 to service the 12 machines in the district. They put a proposal together for our district saying we can save you $4,000 by offering you 12 brand new machines at this state bid, low bid list at $100 a month for each machine, with free supplies and free maintenance for 3 years at $12,000 a year. It made sense to the district. It made sense to the Director of Business and Technology. So we're going forward with that plan. And what's going to happen is these RISO machines will be declared surplus. We can't fix them anymore. We don't want to fix them anymore. And then we kick in the policy that follows surplus. It'll be offered to people in the town first. Somebody in Council on Aging wants one of maybe the better machines and wants to pay for a service agreement. They can certainly take one. And then they would be offered up to anyone else, generally for scrap or for something else in the district, or for a company that was willing to buy them, something like that, much like we do with an old van that we put to sleep after 250,000 miles or thereabouts. So that's what happens after that. So your action is required to declare them surplus this evening, if you so desire. Thank
So
you.
Chair will entertain a motion to declare them surplus. So moved. Do I hear a second?
Second.
Discussion. Hearing none, all those in favor say aye.
Aye.
Opposed? It is surplus.
Just to clarify, RISO machines for the folks in the public, RISO machines are a high-speed duplicator that replace the old blue ink that you probably had as a kid at school, Spirit Masters and Spirit Duplicators. But they're high-speed, and they don't charge us by clicks, if you will. Most copy machines and copy contracts charge us by clicks, and these basically are a drum that produces these high-speed duplicating for copies of generally over 100 or sometimes over 50, it's cheaper to do them over 50. So that's what a resew machine is. It just happens to be a brand name, but they've been around for a while and they're very effective. So thank you.
Although we did bring the Ockers Company in here tonight, I do want to also thank the South Middleborough United Methodist Church. They gave a generous donation to the Family Resource Center in school supplies and money. So we thank them for all they did. With that, our next school committee meeting will be October 21st. Chair will entertain a motion to adjourn. Do I hear a second? All those in favor say aye.
Aye.
Opposed? It's unanimous. Thank you very much, everybody, and good night.